The next student is Jennifer Loomis, who is a sociology student here at Portland State University. Her thesis is titled, Explaining Physician Activism in the Oregon Movement for Single-Payer Healthcare. Jennifer.
In nearly every major international comparative study of healthcare systems, the United States comes in last on important measures like quality of care and equity of access to care. The healthcare systems of the nations that perform better than us look a little different from each other, but have one important thing in common. They're all financed by a single, nonprofit payer. In these single-payer healthcare systems, medical care is treated as a public good, and everyone has access to medically necessary care, and physicians only submit for reimbursement to one payer, simplifying their administrative burdens. Right now, in several US states, there's growing grassroots movements to enact single-payer healthcare. One stakeholder that has a lot of potential to improve the effectiveness of these movements is the physician community. And in fact, a 2008 study using a nationally representative sample found that 59% of US physicians support legislation to enact single-payer care here. So if there's broad support amongst physicians for single-payer, and they have a lot of potential to be influential in the movement, what gets physicians to be activists for single-payer healthcare? That essentially became my research question. I interviewed 21 physicians around the state of Oregon. I had a mix of activists and non-activists, males and females, physicians who were retired, those still practicing, and a mix of medical specialties and practice settings. I found that the physicians who were unwilling to become involved in single-payer activism were largely discouraged by their belief that single-payer would never happen in America. They cited Americans' distrust of government and a political stalemate in Congress. They said that prior activism on this issue had gone nowhere, and activists were just wasting their breath. But the physicians who did become activists were able to get past all of that. They were very strongly motivated by a commitment to values of justice, equity, and fairness. They expressed moral indignation at the wasted resources and preventable suffering they witnessed. They said they felt they'd been turned into mercenaries, forced to sacrifice their medical ethics in the pursuit of profit. So these physicians wanted to bring the healthcare system more in line with their morals and values. While they weren't entirely convinced of the efficacy of their activism, they all agreed it was the right thing to do to try. So this information about barriers and motivators to single-payer engagement can inform recruitment efforts and bolster the movement for single-payer. But even if single-payer isn't achieved, this research exposes sources of physician discontent, which could then identify further intervention areas in order to bring Oregon closer to a higher performing healthcare system. Thank you.